I know some of the folks in here. My name is Gary Stolf. I'm a social worker and a chemical dependency counselor, a motivation, interviewing, a consultant and trainer, and been doing this for a long time and just really enjoy it. My guest here today is Robin Lutz. She's an MSN a nurse. She was a project director for this project, and as I said, she doesn't have a camera available, but I want to show like a short brief video of her in the top program, and then do like a 5-slide overview, and then we'll talk. Sound okay? Okay. Can you see that okay?
The lack of birth spacing and rapid repeat pregnancies can lead to prematurity, and prematurity is the #1 cause of infant mortality. We have a crisis in Ohio. We have an infant mortality rate that is comparable to a third world country.
Birth spacing is important because you can have abnormalities in your baby, and you can also have health problems of your own.
We also know that a child of a teen mom is likely to become a teen mom themselves. The mission of TOP is to prevent rapid repeat pregnancy.
The 3 components of the TOP program are home and phone-based care coordination using motivational interviewing. The second is facilitated access to contraceptive counseling. And third is psychosocial assessment to ensure trauma-informed care.
The home-based care is really important to us because we try to have a home visit with every single patient. And during that home visit, we're talking about birth spacing education and the patient's goals of how many children they want to have and what that looks like for their family.
Home and phone-based care coordination is pretty literal, pretty much what it sounds like. It's actually taking care of the patient in their home or navigating the tasks that they need to do via a phone call, helping them to problem solve over the phone using motivational interviewing.
The contraceptive bag is one of the key components of the TOP program.
We found right away that the contraceptive bag was one of the pivotal things that made the young women choose the LARCs, the long-acting reversible contraceptives. As we teach, we start with the most effective to the least effective.
We also give them access to contraceptive through our transportation. So we, as the TOP nurses, have access to a van within our program where we can pick up the patients from their home and take them to their OBGYN clinic or women's health clinic, and they can receive whatever kind of birth control they have decided on.
I like the TOP program because it gives you a lot of education on birth spacing and taking you to your appointments, actually providing transportation. I thought that was great.
Having a social worker in the TOP program is essential and very important because being a teen mom is hard. And when there are other issues such as, safety or, food insecurity or the lack of housing, it's really hard to put birth control as a priority.
We recruit patients beginning at 28 weeks of pregnancy. What this looks like is us going to different OBGYN or women's health clinics anytime after the patient reaches 28 weeks to invite them to be a part of our program.
I was young and I was pregnant. They asked me if I would like to join the program, and they told me a little bit about it, and I thought it was awesome.
The 18-month results of the TOP study are very exciting. They're exciting because there was a 50% reduction in rapid repeat teen pregnancies.
We had an increase in LARC use, and we also had an increase in teenagers using some sort of birth control.
The TOP program is important because it acknowledges the dignity of patients. It acknowledges that patients can make their own healthcare decisions, and I think it's very empowering for the patients. I'm very proud to be a part of it.
Thank you. I'm very proud to be a part of this as well. I mean, it was an amazing process. And Robin, you want to talk a little bit about the video?
Sure. Just to start with the slides, or
Oh,
the
okay.
video in itself, the video in itself, you mean?
No, we'll do the slides now too, and then just open up the.
Okay.
Okay.
Okay, sure.
So let's see.
You want me to just go ahead with the first one? Oh. I see, you don't have them up yet, sorry.
Okay.
There we go.
Can you see that okay?
Yeah.
Let me do it this way. Here we go. You'd think I would have a handle on this after doing years of online work.
There we go.
So, teen options to prevent pregnancy. Robin, who actually is a dear friend of mine, and I was the MI consultant on the team. Randomized control trial to increase birth spacing and reduce rapid repeat pregnancies. That's so powerful, Robin, when you said, like the mortality rate in Ohio is like a third world country. Do you want to speak about that a little bit?
Yeah, we are not, we're not sure of the causative factors. There's a lot of mistrust of the healthcare system, and the disparity between Black and white infant mortality is at one point when we did this study, it was triple the rate for Black infants. So we really, tried to look at ways to provide respectful care, and motivational interviewing is what we came up with in terms of working with the teenagers. And I couldn't be more happy that we chose that, because it changed my way of practicing nursing. I was a nurse for 25 years when we started this, and it completely changed the way that I speak to patients, like with checklists. I think our normative way, and is to especially with electronic medical records, the charting is to go down through the records and not at all, use motivational interviewing. And so it was just life changing for me. And Gary was a great coach. I can let Gary talk about the training, but we did the training according to the evidence, and Gary met with us for many years, actually, and did a lot of coaching with us. And I think the young women were easier to train than this old nurse who had worked for years as in the old format of nursing. So, I mean, Gary said that it was a randomized control trial, and we had that one group received they were just teen moms who were recruited to receive remuneration and surveys at 4 points during the 18 months. And then the other group actually received a nurse with motivational interviewing, providing, motivational interviewing with the teaching for the birth control. And there were 598 mothers, ages 10 to 19. And we did have the top tier evidence rating. It was a blind randomized controlled study. And then, the reason we said near top tier, I think, is because it was, the only critique we got was that it was just in Ohio. It's being replicated now in the Bronx in New York. That's an overview. If you want to go to the next slide, Gary.
Sure. Yeah, 297 young women were in a treatment group. This was from October 2011 to January 2014. And like Robin said, half a reduction in pregnancy as opposed to the control group. And then they had as participants who were 18 or 19 years old at the start of the program, they did another check-in at 30 months post-enrollment, and 24% of the treatment group became pregnant versus 36% for the control group. So that was
and this, you can see the difference is not 50% here, and that is because what was published, we had to use only the 18 and 19-year-olds in this study because just because we had to gather data from the Department of Health. So that was for just the 18 and 19-year-olds, that was the reduction.
Yeah.
So, yeah.
Okay. All staff went through a 2-day, 12-hour motivational interviewing training. Just kind of a standard dose 2-day training, spirit for processes, skill training, practice, and provide elicit in particular regarding contraception, so people could check out what the nurse knew about, or I'm sorry, what the participant knew about this particular way of conception. Birth control method, and then provide information, then check out their understanding of it. Combination, of course, lecture and discussion, demonstration, skills practice, ongoing questions and feedback during the participant's training, coaching bi-weekly, and MIDEs were done randomly, and individual coaching was done to review the results of the MIDE. How was that for you, Robin?
The coaching was wonderful. I had to relearn the way I communicated with patients. I think in nursing school we talk about open-ended questions, but I didn't know anything about motivational interviewing before we started. I had started to hear about it in just journal articles that would come through my email, but I didn't know a thing. So Gary did the 2-day with us, and I think that was true for all of us. None of us had had any experience prior. And then and then the skill training and practice each Monday night we looked forward to, because we would run into issues where it was difficult for us who were not trained counselors, and Gary was able to help us with how we could have turned the conversation more, to more open-ended. Gary, I'm happy for you to talk about critiques with us. It's okay. You had a lot to teach us, and
Well, like Rob is saying, I mean, when you practice in a certain way for decades, and then trying to practice in a complete opposite manner is very difficult. But it's such a joy to see people like not have any information or practice in MI, to being trained and coached where their practice changes. And it was beautiful listening to the tapes when I would code them and just see the dramatic change. Yeah, that was wonderful.
One of the things I think that is simple that I do every day now is just ask for permission, to provide information. So, my job is to present the research to them, in terms of their healthcare decisions. And, before I would just spout it off and expect them to accept that. And I feel like, just simply asking, are you interested in what the research states about, for me now, it's breastfeeding, but during the study, it was birth control, but in every way. And then with the birth control, just giving them time to tell me what they knew about birth control before I gave them the information, provided a chance for them to tell their story a little bit too. And then just the elicit was very good too, because I think, again, as healthcare workers, we go down through a litany of a list of 20 things for you to receive when you encounter a nurse or a doctor. And I think, to just helping us to elicit, whether or not they wanted and what they wanted to know, what was important to them, and then to provide that information according to what the research showed about each one of the birth control methods. And it was just what I think I loved about teenagers. I worked with teen moms for years before I did this, I've always, worked with teen moms for many years, and the way that their body language changed, they would be, forward and defensive. And then as we use motivational interviewing, for me as a nurse, what I noticed, the tools just allowed their shoulders to go back and them to, feel empowered. And that was something I noticed right away. Such a difference. That's why I think the study was so successful.
Excellent. We have one more slide. This is from Millen Rolnick's Motivational Interviewing, the 4th edition. And learning MI involves a paradigm shift in healthcare from health expert to health guide. That's like an about phase for some folks, because you do have expertise. You have a lot of training and experience, and in MI, it's more about instead of seeing myself as the only expert in the room, there are 2 experts, and my information, my knowledge, my training can help guide people, and at the same time, not lose track of autonomy. That the person, decides what they're going to do. And I think Robin and her staff really lived that out, which is disarming. When you're used to people approaching you a certain way, and then they approach you in a completely different way. That's it's like, oh wow, so you're going to listen to what I say. It's wonderful. From education, what Robin, a lot of nurses are trained to provide education, and instead of doing that, as she has said, they move more to evocation, like trying to bring forth within the person, desire, ability, reason, and needs to use birth control. From confrontation to acceptance. And that's a joy to watch too. Like you saw the couple clients in there were just at ease with the nurses, and it was just wonderful. From imposition to collaboration, and from protection to compassion. I think it's kind of an issue where some in healthcare get kind of stuck, because it is true. If you don't do this, then this will happen. So this writing reflex, fixing reflex comes out, and you need to protect the person from themselves. The problem is it doesn't work. Any comments on this slide, Robin?
No, I was just thinking about, I accompanied the patients. So we had our motivational interviewing visits with them, and then we provided transportation to take them to their birth control, to their appointments. But I heard so many healthcare workers say, you don't need a baby right now, rather than what Gary taught us to talk about is to say, when do you want to have another baby? Would you like me to share what the most healthy birth spacing is according to the research? And, I never had one student say no, but, it was empowering for them to be able to ask and then to provide that information. That 18 months of, is the recommended birth spacing for a healthy mom and a healthy baby. So I just think, again, I heard the opposite time I took the patients to their appointments, because they're teenagers, especially, people feel like they can instruct them and almost, in a condescending way.
I'm the adult here. Yeah, not so much. Okay, that's all of our slides. We'd like to open it up for a discussion.
Gary, I'm guessing that would be called the adult trap.
Yes. Yeah, that's what that is. Yeah. I know best.
What an amazing story. Robin, thank you so much. And Gary, this is just so moving. The idea of a 10-year-old part of this study. It's what a great service to humanity.
Yeah. Thank you. Thank you so much. It was an honor. And I hope some of you can be a part of providing what Gary provided for us, because it was transformational. If you all can enlighten nurses and doctors, that would be great.
Yeah,
go ahead. Sorry.
Robin and Gary, just want to echo what Skye said, and just what an incredible offering to our world and to these teens who I can only imagine feel overwhelmed and alone. And Robin, I'm one of those old nurses as well. So I know that shift that happens for us, and what a beautiful shift and a different way of being than we were taught in nursing school, to have all of the answers and to tell people what to do, to really honor the wisdom within the individuals. And I think I was stunned as well with the ages with whom you were working, and as well the statistics on mom and baby mortality. And what a true gift to our world. So thank you for the work that you're doing.
Thank you. Thank you.
Questions?
I can echo what Sky and Jody said, Robin and Gary, and just say very inspiring contribution. And thank you so much for sharing. And Robin, I really was, excuse me, interested, well, in everything you said, but the comments about the nonverbal behaviors and responses of your clients is very powerful. I'm interested in, as many other things, nonverbal communication. So your observation that the whole response nonverbally was very different. That's measurable, I mean, by people who study nonverbal communication. So it'd be really interesting. I did have the things that you did were both inspiring, life-changing for so many people. And as you said, Robin, learning it was life-changing, and all that's inspiring. I had a nice part of this, not be nice. The nice additional part is the science, and I had some questions about that, but I'd like to take another question first, which is that to some extent, you guys are preaching to the converted here, right? This is a group of people who are either all in mint or very near mint. So that's not a criticism at all, and it's wonderful for us to hear these stories. These are the things that, Gary, that we all hope to bring in this nice way that you brought it, or have done it, or are doing it. So from the point of view of people who are deeply invested in MI, who know what it does, have experienced it, I'm wondering if it makes sense to think of lessons learned and challenges, solutions sought, which is one of the purposes or things that we try to get out of this kind of meeting, for people in Mint who are asked to bring these things. What you've contributed is enormous, because we have these stories to share with colleagues. But in addition to the story of your successes, is there certain kinds of solutions that you maybe are still seeking, having done this work? Or is there a particular methodology that you brought to this experience that can enrich us as we are asked to do similar kinds of things? So, and take this in no way as a criticism, it's just trying to wonder about pushing it a step further.
I know that Robin has been called on in the past to talk to other nurses in other parts of the country who want to replicate this. And she's done trainings with them, and really, I don't know, it's
and it may be fine. I mean, what we're doing, I mean, what you've done is you took 40 years of Miller and Rollinick work in MI4, and you packaged it.
Yeah.
And brilliantly. I mean, and that's okay to hear the story. Well, you know what? It still works. It was a great idea. It worked, and we have we have 5,000 studies, and guys, it really, really works and changes lives. So that's okay, an okay answer. So in no ways is this critical. So it's more like, is there some packaging that you earned? Is there something that we can take home that you really did well and very specially? Robin, I did hear that Gary and so many, I don't know if there's a charisma and a quality to the way you did the coaching, because it sounded like he's got some special, he does that well, is there?
Yes, he does.
So, right. So maybe that certainly is what does he do that we can learn from? Mint tries to make everybody a Gary, but it sounds like he's got some special charisma and dynamism. Anyway, the answer could be, I don't know, just keep going. But anyway, that was I'm curious about.
I think Gary does have a way of being so respectful, because really a lot of us did the old-fashioned way of nursing, of just providing information. And Gary would not say, "Oh no, that was all wrong." He would always say, "You are all so compassionate, and you all have the spirit of MI. You have such an important component of the spirit of MI, and that you are so compassionate. However, on the one hand, I'll use so far from MI, you have this compassionate spirit, but on the other hand, like, here's an opportunity that I saw, where you could have, there could have been an open question. I mean, he had the mighty there, so there was objective information where he could say, why it was scored the way it was scored. But he also, was able to coach in such a respectful way. He himself is walking MI. So we always said that he was great to learn from, because he does MI with all when he speaks. So
that's helpful. That's the kind of thing that I was wondering about. So what you're saying is that the MI is a clinical approach, where you're saying it works the same way when we're teaching colleagues. And
yeah,
so Miller and Rolnick teach us that affirmation works well with clients. We're saying Gary's use of affirmation was very powerful and positive as a learner. But it applies just as much to the teaching world as it does to the clinical world.
I have a follow-up question to this. Robin, one of the challenges sometimes when we're trying to teach a whole staff is that a certain percentage of the staff will be really interested and get excited about it. And then a certain percentage of the staff, and as you said, sometimes us old timers that need to unlearn a lot, we're fine with what we already know. And I'm kind of curious, how did you navigate that? And I'm partially wondering, the fact that it was a research study, did that make it easier for folks to be on board? Okay, we're not quite sure, we're going to try this thing out. But I'm just curious from you and Gary, if you're trying to bring the whole staff along, what do you do with that percentage of folks that feel like it's fine what they're doing and just leave me alone?
Robin, was there one person who was hired but didn't really quite work out?
There was. She didn't. And, I had to have really crucial conversations with her. She, first of all, I feel like the people that you're speaking of, it are usually the people that say, I already do this. And they think they do it, but they don't. And so she, Gary had sessions with her. I struggled with her, with communicating, with her being humble enough to want to learn. And she ended up lasting about 6 months, because I had frequent talks with her and just said, how do you think this is working out for you? And it just wasn't for her. It's what she really wanted to provide information to the girls, and said some inappropriate things other than just not using motivational interviewing. She also, had wasn't a good fit. So I don't know, Gary. That's a good point. It was just one person. Everyone else was very open to learning, and we had probably by the end of the 5 years, we had 7 nurses. And then when people started hearing about motivational interviewing in this large hospital system, we were working with 18 clinics, and then all of the hospital, there were 5 hospitals here in Central Ohio that we worked with at first. We've expanded since, but all of those postpartum units, all of the clinics, the OB clinics, we went and talked to those nurses. And some nurses, it was just like you said, is it Sky? Is that your first name? Sky. Some of the nurses were really excited to try this, and then others not. But I will say, I could give a lecture about MI, but I am not a mid-trained person. There are a lot of people that want to replicate our study, and we say the only thing that we absolutely require in replication is that they have a MINT trainer. They have to use a MINT trainer, because there are too many people who said, oh, I can teach motivational interviewing, and they could teach about it, but they couldn't really teach it. So, that I would, ETR, which is their education, training, and research, they're out in California. They just bought this program, the license to this program, and they're going to sell it because they're so excited about it. And, they're going to sell it all over the world. And I said, just make sure that, you require a MINT trained person to be the trainer.
Yeah.
Well, I'm thinking as you listen, don't sell yourself short, Robin, because I hear a lot of wisdom and depth to the way you interact with your colleagues and your patients, which don't undersell yourself. And that's part of actually what I was leading me to say next, because Gary, you keep pointing out and Jody and Heather, others, that MI Med is a forum where we really want to attract non-MINT members, tapping into their expertise and promoting MI, not to the exclusion of MINT by any means, but to recognize there's so much interest and skill beyond MINT that we want to reach into that. So certainly you personally, Robin, and your colleagues and friends, and I know Gary's working in that direction, as is Jody and a few others. Please join us in MI Med and bring your skills, competence, interest, enthusiasm, passion to this group.
It was completely a joy to work with Robin and her staff, because they invested and really made for some people, some significant changes, and you see the results. I mean, that the way Robin is with her clients, it's just what you saw. Just really loving and caring and compassionate, and works with some very complicated issues and concerns, and they developed this. The clients developed this care for her as well. And sometimes that's a lot of undoing to do, right? Where, folks have had maybe a negative experience of a nurse at some point, and then they meet Robin and her staff, and they say, oh, wow, that's where the shoulders go back and people are more relaxed, and okay, this can work out. So.
Can I ask a question? Oh, Jody, go ahead.
Go ahead. I was just going to say, so very well said, both of you, Robin and Gary. And, that we in healthcare, even though nurses are, the most trusted profession, we've all had those experiences, and it's more common than any of us would like to say, of how sometimes those visits can be demeaning, off-putting, humiliating. In the line of work I'm in, I hear it all the time. And this is just such a great way to be able to put really care back into healthcare. And, Robin, you said earlier, and I just thought it was such a great distinction, you were talking about Gary and his way of being MI, but you said something about you didn't want just to know about MI. And it's like each of you has really put that on, and really a great way of a new set of tools, because most nurses do come into the profession with that caring and compassionate heart. And we aren't given the skill set or the tools to really be able to be effective in that care piece. And that's where MI, and what I heard you describing, Robin, was being MI. It wasn't doing MI, it was really being MI. So kudos to the both of you.
Thank you.
Thank you. Thank you so much. Well said. But, yeah.
I'd love to ask a question real quick if there's time.
Sure.
So I've worked on a project previously where I was providing instruction and coaching to healthcare teams on contraceptive counseling and family planning. So I know a little something about that, but I've never done that work specifically for minors and young adults. So first of all, I'm just deeply appreciative that you took the initiative to do this and that you're willing to share this. Thank you both. I'm also curious, were there ways in which like the content or the methods of your approach needed to be different for younger clients, or were those pretty similar for clients age 10 through 19?
Robin?
I will say with the young ones, they can't express themselves, nearly as well. And every year, they were able to express themselves more. But the young ones, we would call for our follow-up calls after the baby was born. I think that, and we would say, how are you doing? And a lot of them said, good. I mean, a lot of, single answers. And so Gary taught us I feel like the most effective with the very young were to the exaggerated reflections. So we'd say, so you and your mom are getting along great, and the baby's sleeping through the night, and, and then they would correct us. And so I feel like that was the best tool with those young ones, and just gaining trust. It took a lot more time to gain trust with the younger than the 17 and 18-year-olds.
Is this really you? And it is.
Yeah, so many times they'd say, why are you being so nice to me? And that would make me almost want to cry, because I thought, why weren't we nice? Why isn't any, but I think it's just such a way of honoring someone, and I love it. I just preach it from the mountaintops in the healthcare field. And I have been able to share it with our med surg colleagues as well at our hospital system. And then I was asked to speak several times at other hospitals in our hospital system. But again, it was about MI. So I was like, I really would love it if we could do a series with Gary, to actually teach more skills. But yeah, the longer the better, I would say.
I definitely, it definitely resonated with me. I'm a child psychologist by training, and so I work in an adolescent health clinic, and really appreciate the value of motivational interviewing in that setting. I work with a lot of teens who are using substances or engaging in, more healthy, more risk types of behaviors, and it's just amazing how I just go back to you're a human, right? And I'm going to talk to you with that respect, and I can only imagine for your patients how nice it must have been for them to appreciate, wow, nobody talks to me like this. And probably since they found out they were pregnant, it's just been lecture after lecture. And so I really love the work that you've done, and appreciate it from the standpoint of how receptive and
engaged adolescents can be when you use motivational interviewing.
What does it say in the 4th edition? Good listening is so relatively rare that when you start listening to people, they want to open up and tell you more.
Yeah, I got a call from patient last week, and she said, this is going to sound strange, but will you, and this woman was from the study, and she said, will you come to my son's 10th birthday party? Because 10 years ago, I mean, I think since for the past 10 years, you know, you're the only person who believed in me. And I thought, oh, how sad. But yeah, but I was glad to go to the 10th birthday party.
How sad, but how special for you, and how special you are to that person.
But I don't think I would have been if I have to say, I don't think I would have been if I used the way that I communicated before, which is almost, you know, it just is a power differential when we just provide information at them, you know, and I think that it just was so much more respectful, and I love motivational interviewing. So yeah, I really appreciate being able to learn.
So, appreciate you guys being here.
Yeah, thank you so much.
Thank
I
you
don't know, are you all learning about motivational interviewing or MINT trainers, or I don't know the audience.
MINT trainer.
I'm a MINT trainer.
I'm a MINT trainer.
Okay.
Also a Minty.
Okay.
So a year from now, we hope that question will be half of the people on this call will not be in MINT.
Yeah.
Because that's so in MI Med, you know, for more than 10 years, we've been trying to expand beyond MINT. So you just asked the exact question where that's one important way we have not succeeded. That this audience is entirely MINT. So it'll be, I think most of us here would value when half of us will be MINT trainers and half won't. It'll be a big contribution, I think, to the healthcare professions broadly. So anyway, if anybody who wants to help us get there would be a great place to be.
At least, Steve, I can say that at least for registration part, our MINT Virtual Forum, what was day third, was sort of half MINT members, and all they are registered. I can't say how the procedures was inside those people who actually participated. But there is hope that we can also broaden.
That's good to hear. I didn't know that. How many people registered for that third day?
More than 100. And in peak moment, there was 70 and more people presented.
So it's starting.
That's great.
Yeah. So Robin, I'll keep you posted on all this, and
okay, thank you all so much. Thank you.
And you can invite some of your friends.
Okay, I will.
Okay.
I will.
So I guess
that's so much.
Thank you, Robin.
Bye-bye.
Thank you, Gary.
Bye.
Thank you, Heather, for hosting.
Thank you all
Good
for
to
being
see
here.
everybody.
Enjoyed it. Thank you so much.
Really
Thanks
enjoyed
for coming.
Thank
Gary,
you.
good job.
It was
Thanks for
nice
doing
to
this.
see you.
Thank you.
See you all.
Bye-bye.
Heather, are you
Great
the
job.
one with? Will you be the one that has the recording of this?
Yes, and I will share that with Steve, but I'm happy to share it with you we usually say it's available or we post it. So
Yeah, if you don't mind, I'd love to. This was such an important project and so moving. I mean, just really, and Robin's enthusiasm for it, you know, having having been converted by Gary. She drank the Kool-Aid fully, which is always good to hear.
So Heather's been posting a link to get the download, which you can watch for on the Mint listserv, and then I pick it up from there and I put it in my Google Drive.
Okay, yeah, if you'd send me whatever I can to see it. And so the research on this has been published. It sounds like it was a full-on thing.
I don't know about it, but Gary posted that link that showed something, and you could write him.
Okay, very good.
And he can share whatever his publications, or there's some of the manuals and stuff he is able to share, or he might be able to share.
Yeah.
So you could ask him for that.
Nurses can be older nurses can be such a tough group. I was really, and he was just the right person, it sounds like, for the job. Yeah, really, really good. Thanks. Look forward to being here next time.
Sounds
good.
Great.
Thanks
Thank
for
you.
coming, Sky.
Thank you. Bye-bye.
Okay, bye, everybody. Bye.